සැත්කම් සඳහා ස්ථාවර අවමගාස්තු දැන් නවලෝකෙන් අමතන්න 0.771
Sri Lankan health authorities confirmed today that the more virulent and deadly strand of COVID-19, the Delta variant, previously identified as the Indian variant in Sri Lankan community. The Delta variant has been the reason Sri Lanka's neighbour India experienced a surge in infections and deaths to the extent the country's health system could not tend to the daily infections. Director at the Allergy, Immunology and Cell Biology Unit at Sri Jayawardhanpura University, Dr. Chandima Jeevandara, said that 5 out of the 9 samples obtained from the area of Dematgoda had the Delta variant.
We have detected the Delta variant, which is commonly found in and first detected in India. We observed that there is a change of the pattern of the patients we saw over the past 1 week, especially from the samples received from Colombo. Because of that, we immediately started our genetic sequencing, the latest run, and from that we have detected the Delta variant from the Dematgoda area. The symptom profile is a bit different to the ones we observed with the original SARS-CoV-2 virus. For example, if I say the previous symptoms were fever, cough and loss of taste and smell were the cardinal symptoms of COVID-19 illness, but associated with Delta variant, they have increasingly found that sore throat and runny nose are commonly found apart from fever in patients who has Delta variant. It carries a specific mutation which facilitates a strong attachment with the human cells, so that's why it is considered a virus with increased transmissibility. Because of the L452R mutation, it is said to be more transmissible compared to the other variants.
Dr. Jeevandara also said that a person's immune system will only stand a fighting chance against the virus if they receive both vaccine doses.
The main problem with Delta variant is it is reported to evade the single dose vaccination. For example, for vaccines which needed 2 doses, you will get the complete protection only after taking both doses. So it's very, very important, especially the vaccines Pfizer and AstraZeneca. You need both doses to get the complete protection against Delta variant. So with single dose, the protection is about 33%. With both doses only, it increases up to 60% in case of AstraZeneca vaccine, and it's about 88% in case of Pfizer vaccines.
In this backdrop, Deputy Director General of Education and Research at the Ministry of Health explained that 2 types of surveillance systems are currently in place to ensure that all patients with symptoms of influenza and all those with acute respiratory issues are tested for COVID-19. He explained that this would be done in a bid to ensure that no COVID-19 patients slip under the radar of the health authorities.
And also we need to emphasize that we have 2 other surveillance systems that were going on, that is ILI, influenza-like illness surveillance, where all people who are coming to hospitals with respiratory symptoms and influenza-like illnesses will be subjected to test for COVID-19. In addition to that, all persons who will be coming to hospitals with severe acute respiratory infections like pneumonia-like infections or any other breathing difficulties, we call it SARS. Those patients also will be subject to COVID-19 testing, so that we can find out any missed person not detected during the routine activities, so that we can minimize the chances of missing any patients. That will be continued, and if the numbers of new cases going down, more and more tests could be done as random testing in future, depending on the prevalence and reporting of new cases.
He also urged the people to continue to adhere to the health and safety guidelines and not do away with things like wearing face masks simply because they are vaccinated.
We need to understand that whatever the vaccination that we give will not 100% protect us from getting the infection, and also it will not 100% prevent the transmission of disease from one person to the other, and therefore we need to make sure that all required health guidelines are adhered to. In addition to that, we need to keep in our mind that up to now, with all the difficulties, we have been able to cover only a small proportion of around 10% of the population with first dose vaccine and less proportion of people with second dose, and therefore at this moment all citizens of Sri Lanka need to adhere to the stipulated health guidelines until the need for such adherence is relaxed or released or stopped after considering the epidemiological situation and other factors.
As for today, 1,835 fresh COVID-19 cases have been confirmed so far in the island, with 1,289 patients also being given the all clear to leave their treatment centres. Sri Lanka's total COVID recoveries jumped to 195,434. That puts the number of active cases in the country at 36,554.
වීව එකතුණු උකුතේ එකක
රස උපරිමයි.